Dr. Anjana, coming from a family of doctors, was choosing the medical profession a natural path for you, or would you say there was a moment of divine intervention and choosing this career? Please.
Om Sai Ram. My humble pranams at the divine lotus feet of Bhagwan Sri Satya Sai Baba. My special thanks to Kamla ma'am, Pandya sir, and all the organizers of this wonderful conference for having us all here today. Before I answer your question, ma'am, I'm going to tell the audience something. You guys have been sitting there for the better part of 2 hours very quietly. Now, in this session, no more quiet. There's an audience interaction, and this goes as follows. I'll give you a cue, okay? It'll be something like, when you're in doubt, when you're in pain, when you're something like that. And you say, go to Swami, right? Everyone ready? Yes, okay. So here's now where I take the question. So she asked me, yes, I have illustrious parents. My father is Dr. V. Mohan. My mother is the late Dr. Rema Mohan, a very illustrious ophthalmologist in this country. And I think what really, really helped me was their involvement with Swami throughout their lives. Right when I was 3 years old, I used to follow my mother around. She used to go to Sai Seva. We used to go to rural populations, poor people. And she was an ophthalmologist, so that means she was treating eyes, right? And I used to see her giving vision. And at the age of 3, I decided I would also, in some way, heal. And if that is not divine intervention, I do not know what is. Swami lets you see right from that age along the path that he wants you to go on. Now let's fast forward a bit. This is my 10th board exam. I had a very, very high fever. You know, board exams come once in your lifetime, right? So we had finished the theory exam, was writing the practical exam, and I developed a very high fever. I couldn't go. I only had my science practicals left. So my mother stood by me, took me to school. I had to go because I had to write the exam. And constant prayer. I was a young, feisty teenager. But I had a very, very pious mother who went on saying, Swami, let her write this exam, Swami, let her write this exam, Swami, let her write this exam, right? And through this entire process, I was imbibing this. I can't tell you how dramatic a situation this was. And so she gave me to a teacher who was then supporting me and walking. I couldn't walk and all that. So then we reached the lab where the exam is happening. Teacher exit, I enter. The minute I put my foot into the exam hall, suddenly my mind cleared. The fever went away. You know, I was able to think. And I can't tell you, my physics and chemistry practical, prism experiment, and the drop of the color thing in chemistry, I've never done it so well in my life. Okay, that was Swami and only Swami at that point. And just to make a point there, the second that exam was over, I came out of the exam hall and collapsed. I was in hospital for 2 weeks after that, okay? So was that divine intervention? What is it if it's not, okay? So that's a second. Now let's fast forward and go to 12th standard. So 12th standard, every doctor's dream is to get into a government medical college, right? So you study all, very, very hard for 2 years, give it your all, and finally you get into a government medical college. Wow, this is life's dream. And then Swami comes in my mother's dream and says, don't put her there, put her in another college. Okay, what on earth does that mean? So when in doubt, go to Swami. Go to Swami and ask, Swami, what is this all about? I've worked so hard, you made me get this, and now what does that mean? And Swami says, just follow what is told to you. And obviously, that's what you do. So I went there. Later on, it turned out that so many other things happened, connections, international connections, things that I would have never got in a government college actually came through when I look at it so many years later. Now let's fast forward. I have reached my MD final exam, okay? I had a very tough year, very hard examiner. I used to be in OP at 7 a.m. Our diabetes OP starts at 7 a.m. At 9 p.m., after a whole day of work, I had to call my prof and report to him what and all I'd done, all the patients I'd seen. And at that point, he'll say, go do this, go give blood, go give this, all that. As a final year PG, you need time to study. We have 2,000 pages to read in that one book alone, right? And there's no time. So I went through this whole entire thing. Last few weeks, somehow I studied. And the day before my exam, I was in panic. And I told my dad, I'm not going for the exam because I'm too scared, I haven't studied anything. And try as he might, nobody could convince me. I just said, it's okay, I'll write it after 6 months. I'm too scared, I won't go. My dad goes to the puja room. You know these sayings of Swami? 365 days a year, those sayings come. But about 5 minutes later, he comes back with a saying that says, hard work is always rewarded. Awards and recognitions will follow. Needless to say, I went for the exam, and to my shock, I also received the gold medal for the highest marks in the university. That is Swami, and only Swami. Over to you.
Thank you so much, Doctor. It's so nice to know that Swami was a part of your career decision making. It is said, Vaidyo Narayana Harihi, a Vaidya, a doctor, is equivalent to Lord Narayana himself. Is there any case that you'd like to talk to us about where you've seen Swami working through you directly?
Oh my God, there are so many, right? But let me talk about one thing that I was doing in rural Sai Seva. So I was sitting there seeing patient after patient when suddenly Dr. Shushila Sambamurthy in Chennai, who is a pediatrician, she came to me and said, I have this girl, 6 years old. I think she's diabetic and she needs insulin and she's refusing to take. So that was my first introduction to this little girl called Indumati, her mother, her grandmother, that whole family today we know. Okay, she came crying and screaming and saying that she won't take insulin. Because you know what? If you go to rural areas, they say that insulin produces kidney disease, insulin produces heart disease, insulin is like, the bad guy. So for that reason, she refused to take insulin. Now, she has a disease called type 1. Now, you may know that type 1 diabetes means there's no insulin in the body, and without external insulin, this person will just die. That's it. There's no other, alternative. So you have to give insulin for survival. So here's this little one, her mother's crying, she's crying, 6 years old, okay? I'm trying my best, she's screaming, tantrum, no way of getting through to her. When you're in trouble, go to Swami. Swami, help me, Swami, what do I do? What do I do? How do I convince this little one and her family? When I came back, there was vibhuti on my stethoscope, okay? And soon, the mother came and told me, now my daughter has agreed to take insulin. How did that happen? I have no clue. Certainly nothing I did, right? All I did was like, Swami, help me. That's all I did. So I found that this child is now willing to take insulin. She started listening to me. She said she had lost her father recently, and there's one more girl. So there's a mother and 2 children. There's a grandmother, mother, 2 children. It's an all-woman family with no man. And having type 1 diabetes, if you don't know, it's a very expensive affair, and it's not easy in any terms, right? So we had a tough time of it. But today, I saw Indumati day before yesterday, before I came to Parthi. She is on an artificial pancreas. Her sugars are her lifetime best. She has no complications. And by Swami's grace, that one child is an absolute work of Swami.
Thank you for sharing with us, ma'am. I'm sure it gave goosebumps to all of us. Swami is indeed a witness to every one of our conversations. Thank you, ma'am. Being an accomplished medical professional, can you throw some insights on how to manage situations that are beyond human comprehensions? In such cases, what do you do, doctor?
Beyond human comprehension. That's where Swami comes in, right? So I'm going to talk about, the first one is, I'm going to talk about 2 things here. The first one is my maid. These are actual stories that have happened. So my maid has been in my family for many years. Her daughter had become 30 plus years and couldn't conceive. So they were praying and praying, saying, Swami, let them have a child. Finally, she conceived. Somewhere around the 5th-ish month when they did a scan, they were told that this child has a congenital anomaly. That means that there is a defect in the baby and you have to remove that baby. And she may never have another baby, right? So it was a precious baby. It was too, it was such a stress on the entire family. Needless to say, my maid was devastated. The entire family was devastated. So what they did is they took a blood test and they said, this blood test will confirm what we are telling you. So we're all saying, okay, and it'll take 2 weeks for the blood test. Everybody in the family is crying, devastated. One child, one chance, it's gone. And there's never going to be a child in that family again. So what I decided I'll do is that I didn't tell anybody. I decided to pray for that child and the mother. 14 days I had. I decided, okay, every day let us, pray to Swami, and I did this without anybody's knowledge. Fast forward to 14 days. On the 14th day, the report is supposed to come. That is a day I can never forget in my life. My maid runs excitedly I was on the treadmill getting my morning workout done. She runs in excitedly and she says, Amma, the result is normal. I was like, what do you mean the result is normal? Then she says, no, Amma, how can she know? The result has to come to me. I'm the doctor, remember? So I was like, how can she know about it? Then she says, no, Amma, Shirdi Sai Baba came in my dream. I'm praying to Swami here. Okay, Shirdi Sai Baba came in my dream and told me, go and tell your Amma, she has been praying. The report is normal. Okay, this happened. My shock, I didn't know anything. Few hours later, the gynecologist calls me and says, I've never seen anything like it. The report is normal. Okay, so what is Swami's teaching point in this, right? There are 2 or 3 teaching points that we've had so far. One is in college, okay? The teaching point there is, when you lose faith in yourself, Swami doesn't lose faith in you. He has that faith in you. So remember that. The teaching point from this is that it's just about faith. We were talking about how we get instructions for Swami. But all this is happening at a time when Swami is no longer there. So we needn't worry that we cannot touch Swami, we cannot see Swami. Swami talks to us every day. If you take the effort to talk to him, he will reply to you even today. So that is the second point.
Thank you so much, Doctor. That was so inspiring. Women are the most multifaceted creations of the Lord. And to be a doctor amongst that, I'm sure must be a task in itself. So how do you manage your family life, your career, and being a part of Swami's mission so actively? And what is the message that you'd like to give to the 3,000 plus women seated here?
So I think Swami is part of daily life. Swami is not a separate entity or something like that. Swami is part of daily life. So whenever we are in doubt, when we are in pain, when we have any questions when you're in trouble. So I just think Swami is a part of daily life in whatever you do, small things, big things. I'll just say one more story. There was this friend of mine whose father-in-law was diagnosed with he came actually because he was very tired. And I found his hemoglobin was very low. We found one big stomach cancer there. And being like 85, 86 years, nobody would operate on him. They just said, palliative treatment, whatever can be done, he's too old to be operated, he will die on the table. So again, it was a situation over 3 years. This happened during COVID. Over 3 years, I gave this man nearly 40 units of blood. And every time he would bleed, come back, bleed, come back. Last year sometime, even after giving him the blood, nothing was happening. His hemoglobin was low. Basically, he was dying, slowly bleeding and dying. Now go back to, nobody wants to take him up, okay? He's just going to bleed to death. So then, when you're in doubt, go to Swami. Go to Swami. The family said, doctor, whatever you say. My team said, ma'am, very high risk. If you say, I will do. I said, I am not saying, Swami is saying. So, prayer, Swami said, go ahead, I will take care. Okay, we operated on this man. You won't believe what the issue was. The stomach, which is in the stomach, had migrated to the chest and was behind the heart. So every time he ate, he developed chest pain because his stomach and his heart were behind each other. So he was started to eat every time. So the surgeon had to first, 3 years it was there. He had to first, relieve the stomach from the heart, pull it back down into the stomach, okay? And then seal it, remove the tumor without even spilling anything, seal him up, sent him home. Today he's walking around fine by Swami's grace. So go ahead, I will take care, which no human being can do, only Swami can do. So whenever you have a doubt, my only simple mantra in life is go to Swami, go to Swami. But the last thing that I want to tell as women, there's so much of balancing going on. So many people have talked about children, about profession, about family. my mother showed me that it is possible. So I want to tell you, it is possible. But in order for it to be possible, there's one very important point. And that is something that says, take care of yourself. You cannot pour from an empty cup. You have to mentally and physically be well. So fill your cup with Swami's love. Pour to near and far around you as much as you can, generously. Swami is like the sun. Imbibe his warmth, get his light, and shine as far and as wide as you can. Sai Ram.
Thank you, ma'am. Self-care is something I think all the sisters here need. Thank you so much for these inspiring words. I'm sure we've all been really boosted in terms of how to balance our career, our family, and being a part of Swami's mission. Thanks for your time.